Avartan Dhyan, cyclic meditation, another name for SMET, to develop brilliance, excellence, health and stress-free maturity. Self-management of excessive tension, developed by Swami Vivekananda Yoga Anusandhana Samsthan, a university recognized by Government of India, University of Grand Commission. Let's try to understand the concept of stress, first according to modern medical science and then according to yoga. According to Dr. Sillay and Dr. Levy, the stress masters, stress is a response pattern, how we respond to different demanding situations, varies from person to person, and therefore it is called phylogenetic, and it is common to everybody, therefore it is non-specific and conventional. And what is the purpose of this stress? It helps us to prepare our mind and body complex for physical action to cope with the demanding situation. If you are facing a demanding situation, like for example a fire alarm, then immediately we have to respond. It needs energy, and the purpose of this is either to fight or flee away from the situation, fight or a flight reaction, and both need energy. How do we get the energy? We need to burn sugar, so the sugar level in the blood increases. We need oxygen for burning, so the breath rate increases. To pump the blood to all parts of the body, to each and every cell site where the reaction takes place, we need to pump it fast, therefore the heart rate increases and the blood pressure increases, and we start moving further to face the situation. Then the muscles become stiff and the eyes become bright and all our senses go to a heightened awareness, and you start running or you start fighting the situation very effectively. Now the question is, how is this accomplished? The whole body physiology is very well understood today. When we face a demanding situation, the emotional centers in the brain will trigger off the hypothalamus, which in turn triggers two sets of reaction. One, the autonomic imbalance, and another, the endocrine imbalance. Autonomic imbalance essentially is featured by the sympathetic arousal. You know, we all have the sympathetic nervous system, which is involuntary. When I want to raise the hand, we use voluntary nervous system. Internal functions of the body are governed by the involuntary nervous system, also called the autonomic nervous system, which consists of the sympathetic and the parasympathetic. As the name indicates, the sympathetic nervous system sympathizes with us and brings about all the changes that are needed to produce more energy. Similarly, it is augmented and complemented by the endocrine imbalance. Therefore, the stress button is the hypothalamus. It starts releasing the hormones, and the growth hormone, the prolactin, the thyroxine, all these things start coming up, and we have a number of stress hormones that bring about the changes as we do with the sympathetic arousal. Increased heartbeat, increased blood pressure, increased sugar level, increased respiratory rate, and all that happens by the set of these stress hormones. So therefore, in a sense, stress is an imbalance, and that imbalance is called the disturbed homeostasis. And stress reaction is therefore a mandatory reflex for the very survival. But now look at, on one side we say stress is a big hazard, on the other side we say stress is mandatory. That's the paradox. The problem can be solved when we understand the subtlety. It is good to have the stress reaction with the sympathetic arousal. At the conclusion of the stress, we should be able to bring the system back to normalcy, restoring homeostasis. But if we don't allow this to happen, if we don't allow the system to regain its normalcy, then we end up with the stress hazards. What happens? That the stresses will continue. This is what is happening today in modern life for all of us, because there are a large number of demanding situations, one after another. So you face a demanding situation, the sympathetic arousal takes place, there's a autonomic imbalance, endocrine imbalance, and you start doing the things. At the conclusion of this demanding situation, we want to relax, but yet another demanding situation comes. Another reason is our high sensitivity and sharpness. As we become more and more sensitive, we become more time conscious, and our sharpness increases, and that triggers off the sympathetic arousal again and again. We are a perfectionist, but we want others also to be as perfect as we are. When it doesn't happen, we get upset, we get angry, we get stressed up. Targets to be achieved, target for the year, target for the month, target for the week, and target for the day, and even minutes. All these things in a combined fashion doesn't allow us to stabilize, come back to our normal thing. What is the result? The muscle stiffness, which has increased, will continue, and you may end up with spondylosis, the back pain, and so on. The excessive acid secretion can cause ulcers. The blood pressure which has increased will stabilize. You are declared hypertension. Joint aging will increase fast with arthritis and whatnot. The higher sugar levels, and that gets stabilized for diabetes. That is the whole problem of the stress. Well, if this is how modern science and medical science looks at stress, how does yoga define stress? How does it look at stress? According to yoga, we all have a body which is in a continual flux of changes. But behind it, encompassing it, we have that unchanging dimension called self, and different names are called: pure consciousness, reality, eternity. And the unchanging dimension is our original nature. Patanjali called the Swarupa, Buddha called the Nirvana, it is called the Moksha, called Brahman, Atman, pure consciousness. Different words are used. But coming out of it is the ever-changing dimension of our existence. And this ever-changing dimension has again two dimensions, one the seen and the unseen dimensions. And the unseen dimension are the pranamaya, manomaya, vijnana and anandamaya koshas. The seen dimension in the physical body called the annamaya kosha. Annamaya kosha is the one that helps us to understand our physical body. And in the Anandamaya Kosha, we are all bliss. We are in a state of total silence. No action had started. But in Vijnanamaya Kosha, the actions start, but every action is governed by the right knowledge, the total knowledge. But once we come to the Manomaya Kosha, the emotions start coming up, and the emotions start dominating the scene, and our actions get governed by the emotions rather than our knowledge base. And once we succumb to our emotions, then we have the problem. Our actions go against what is right, and that ends up with a big imbalance in the Manomaya Kosha. And that is the root cause of all diseases, that is the root cause for all stresses, and the stress therefore starts in the Manomaya Kosha and the mind level. Therefore, the yogic definition of stress is excessive speed of mind, the uncontrolled speed of mind. And yoga defines stress as an imbalance in the mental level percolating down into the physical level. It is this excessive speed that hampers the situation and causes pain and leads to ailments, diseases at several levels. And therefore we can say that the genesis and aggravation starts in the psychic phase, in the Manomaya Kosha. They show up as psychological warning, but we don't care for it. We are too busy to look at it. It comes down to the Pranamaya Kosha as hypertensions, tremors, palpitations and so on, and down into the somatic phase, causing target organs, hyperactivity, hypothyroidism, and finally settles down in the target organs, the organic phase, peptic ulcers, bronchial asthma, diabetes, coronary block, cancer and whatnot. So normally how do people try to manage stress? Smoking, drinking. We know both are really no solutions. Smoking could only increase stimulation of the heart. Alcohol can lead to cirrhosis of the liver. It just benumbs our senses. You go to the doctor, and the modern medical world offers pharmacological interventions which can work at the muscular level, nervous system level, or cellular level, at best like beta blockers working at the neurotransmitter level. If nothing worse, then we have this surgery. But everything again at the physical level. Therefore, we are dealing only with the symptoms and not affecting the root cause, and therefore there is no cure to these problems. It's here that yoga offers total rehabilitation by the integrated module of SMET. And this is all based on the Yoga Sutra of Patanjali. Yogaha chitta vritti nirodha, he said. Yoga is to gain mastery over the mind. Well, what is so special about it? We all have concentration. Millions all over the world have tremendous power of concentration. They have become very brilliant, sharp, intelligent. Then can we call all these millions as yogis? No. Why? The very same people who have tremendous power of concentration today are getting stuck. Take for example a business executive who goes to work 15 hours, 20 hours a day. He works incessantly. When he returns home, the same worries haunt him, and he is unable to come out of the thinking loop, and he is stuck, becomes insomniac, and starts drinking. Else he goes for sedatives or pills, and after a few months, if not years, he is in a cardiac ward after a terrible heart attack. Why does it happen? The Sri Patanjali says that the chitta vritti nirodha is to gain mastery over the mind, which consists of two dimensions. One is to develop the power of concentration, and the other one is silencing of the mind. And this silencing of the mind is very, very important, emphasized by the great sage Vasishta in Yoga Vasishta. Manah prashamana upayaha yogaha iti abhidhiyate, he said. Yoga is that skill to calm down the mind, silence the mind. And therefore, we need to see that the speed that is inherently coming up in our mind, excessive speed of thoughts, we have to gain control over it. When we want, we should be able to speed up and use it properly. When we don't want, we should be able to cool down, calm down, and silence the mind completely. And that is the mastery that yoga talks about. Therefore, we should have mastery over the speed at all levels, at the physical level, prana level, mind level, emotional level, and intellectual level. Therefore, reduce the speed at all levels is the message given to the modern human beings. And that brings samatva. Samatvam yoga uchyate. Equanimity, stability, balance, harmony, equipoise, which are characteristics of stress-free maturity. Therefore, we could see that yoga is multidimensional, works at the physical level, mental level, emotional and intellectual level, and provides a total answer to the challenge of stress with a very strong theory. But that theory has to be concretized into a nice module, and that's what SMET does. A special course for executive, a special course for all those who have excessive tension, a special course for all those who want to grow further from where we stand, that is the SMET. We have taken into consideration the time constraint in which we live today. If I tell you that we need to spend 2 hours in the morning, 2 hours in the evening, every one of us will come and say, this is not the cup of tea I want. Give me something for half an hour. If you give something for 6-10 minutes, it will be so nice. And if you give something for 3 minutes, it's wonderful. If you give something for 1 minute, we will practice it. We said, okay, sir, we have something for you for 1 minute. IRT, instant relaxation technique. If you have 3 minutes, we have a quick relaxation technique, and it can take you deeper relaxation when you go for 6 minutes deep relaxation technique. So the SMET program consists of 2 dimensions. One is the relaxation technique, another is a basic frame of asanas. asanas are used as a tool to go deeper into our mental frame and work on our mind, work on our emotions, work on the deeper dimensions of the intellect. And we have been able to show over the last 2 decades that SMET provides very deep rest much more than good sleep. For example, we know if a person sleeps for 6 hours, exceedingly good sleep, then the metabolic rate will reduce by 9% as established by the sleep physiology. But the SMET in just 35 minutes can reduce the metabolic rate by 24%, almost 3 times more rest. And this has been further demonstrated and shown by the recent studies on oxygen consumption, which are done with more sophistication, which have been published in Applied Psychophysiological Biofeedback. And yet another thing is that it enhances the capacity for time management and the executive effectiveness. Once you find that SMET provides greater rest than deep sleep, then the sleep hour comes down. Supposing we are sleeping 8 hours a day, you need probably 6 hours. If you are already sleeping 6 hours, it can reduce further by at least an hour. Therefore, it becomes an investment for time to all executives, and they start learning that art of time management. The executive effectiveness improves. How can we say that? We have done extensive research and published papers showing that the brain functioning abilities will increase. And we have measured the P300, which is an indication of the selective attention in the brain. And we have measured the thing in the frontal cortex, the crown, and the parietal and the back portion of the brain. You could see the pre-cyclic meditation parameters, and you could see in the post-cyclic meditation they are all synchronized. That synchrony, that harmonization is the one that brings selective attention profusely. Also, it shows an increased amplitude, which shows better attention. Published in the International Journal of Neurosciences in 2006 December. This shows the capacity of the brain is increasing. Similarly, SMET can prevent diseases and can bring about rehabilitation of people who already have been suffering from different diseases and can promote positive health. Extensive research work has been done over the last 25 years, and the yoga therapy research at Vivekananda Yoga Anusandhana Samsthan has proven the effectiveness of SMET. We have dealt with large number of cases of respiratory ailments, the diabetes, the hypertension, the ischemic heart diseases, eye problems, the stresses hitting even the eye muscles, causing short sight, long sight, astigmatism, squint, glaucoma, and the SMET and this total yoga can take care of it very effectively. Yes, it can even deal with obesity and back pain. And based on this total approach of yoga, Swami Vivekananda Yoga Anusandhana Samsthan has become a premier yoga university in India, recognized by the Government of India, by the Ministry of HRD through University Grant Commission. The university is very unique in that it has 5 divisions exploring all the applicational dimensions of yoga. Yoga spirituality, the division of yoga on life sciences, division of yoga on physical sciences, management studies and humanities are the 5 divisions. The courses are knit with the credit system and the semester system. Certificate course, diploma course, bachelor's degree, master's degree and doctoral program. And we have number of research students, but it is a small and in-depth research that goes on here, with the students ranging to nearly 400 people now. And our work has spread into 36 countries, and the Vyasa International has spread its wings, bringing the benefits of yoga to everyone in that. And with our collaboration in United States and in Australia, in the top universities, we have been able to expand this wisdom into various research laboratories. University of California, in San Francisco, UCLA, University of Southern California, at MD Anderson Cancer Center, University of Houston, University of South Florida, the Moffitt Cancer Center, University of Miami, Harvard Medical School, and the Mayo Clinic are examples of our collaborative research things. Similarly, Swinburne University and RMIT, Royal Melbourne Institute of Technology in Australia, have been very closely associated with this movement. Alright, what can this Vyasa offer? Vivekananda Yoga Anusandhana Samsthan. We have very nice premises for yoga training with a very congenial atmosphere. It combines the ancient Rishi culture, the Sanatana Dharma, with the pristine purity of the Shastras and the tradition on one side, and the modern research and research labs with the treatment centers. A collaboration with research institutions, it can offer courses in yoga in different states of India. Our Arogya Dhama deals with modern diseases, and you could send your families and friends. We have a exceedingly fine 250 beds facility. We don't call it a hospital, we call it a wellness home, a health home. You could depute your staff from your company for SMET training in Prashanti Kutiram, or we can come and conduct the program in your own corporations. Continue education. The youngsters will start taking the master's degree and the MD and the PhD in our university. So it's a very unique opportunity to serve India through Vyasa International by propagation of yoga therapy and yoga research. And yoga is the science of expansion of consciousness, set in a scenic valley view of Prashanti Kutiram, spread over nearly 100 acres, provides facilities for indwelling and going deep into inner realms of our consciousness, unraveling the hidden potentials of human beings, releasing the stresses, and going deeper and deeper into our inner being. And please take to SMET and save from stress hazards, and save the world from stress hazards. Let us all synergize our efforts to bring peace, harmony, health and bliss on earth. That is the great message of India. That is the great message of Swami Vivekananda to the world at large. So in our next visit to India, please come and visit us in Prashanti Kutiram, a scenic campus of nearly 80 acres. That's where the university is housed, Swami Vivekananda Yoga Anusandhana Samsthan. Thank you all.